The Sacramento Tree Foundation was formed as an educational foundation, envisioning a region where trees are valued for the many benefits they provide, and the Sacramento region as a model for healthy communities for generations to come. The fourth annual Greenprint Summit featured nationally recognized speakers and local leaders discussing the growing connection between the urban forest and public health.
It is our hope that out of one of the outcomes of today's session, that we'll be able to visualize our vision for the next 100 years in every neighborhood, in every county, in every city in our region.
The idea that there's a link between trees and health is not new. It's as old as human history.
When we talk about health, your zip code is more important than your genetic code, and it's way more important. It's not even close.
I was working on things like energy markets, property markets, and I thought, it's not all, that isn't everything, is it? I mean, I'm missing something. In fact, I started to suspect I was missing most of it.
There's a neighborhood in East Cleveland called Huff with a life expectancy of 64 years. Just think about that for a second, 64 years. Just down the street in Lyndhurst, they have a life expectancy approaching 90 years. We try to explain this difference for the most part by lack of access to healthcare and bad behavioral choices. And I argue that this is a lack of critical thinking skills on our part. We're smarter than this. We know that it's impossible to explain that difference based on those two variables. There are other factors, much more powerful factors that are shaping life expectancy in these neighborhoods, and we need to understand them and we need to start intervening in them.
Now, even the most ardent urban tree advocate isn't going to suggest that trees are the only or even the most important driver of birth outcomes. There's a whole load of other stuff. Demography is enormously important. Race, education, income of both parents. Previous births, insurance, good stuff like parks or public transportation, bad stuff like freeways. And then I even went down to the characteristics of a house. I looked at crime. And only after doing that, I looked at tree cover. And what I found was that women with more tree canopy within 50 meters of homes were less likely to have underweight babies.
This is Washington, D.C., where you can see the neighborhood with an 81% tree cover has a median household income of $205,000. The neighborhood with only a 48% tree cover has a median household income of $36,000. And what we know from many, many studies now is that the biggest determinants of health outcomes are the environments in which people live, learn, work, study, play.
We don't live in an ideal world. As you move from relatively wealthy neighborhoods to relatively poor neighborhoods in Alameda County, life gets correspondingly shorter. This is the death tax that we pay. And quite frankly, our work is to flatten that line.
How do you actually take a comprehensive approach so these lines actually begin to equalize, right? That we know that life expectancy isn't just tied to all the things that make us up, but health policy is social policy. So when people talk about development and reducing poverty, they're also talking about well-being.
So why does living in a poor neighborhood actually make you unhealthy? This is where I think we can get to discrete interventions like tree canopy.
Cortisol is an amazing chemical that helps us respond in a really dramatic fashion to stressful events. The problem is, if you are stressed in the morning from a traffic jam, stressed all day long because of that unreasonable boss, go home to a stressful situation through traffic in the evening, and then are met with an unreasonable child, you may have too much cortisol in your system. Too much cortisol in your system messes with your capacity to have a healthy respiratory system, a healthy cardiovascular system, a healthy endocrine system, a healthy digestive system, a healthy reproductive system, and a healthy immune system. If you have chronic stress, you are at risk for getting sick more often, for staying sick longer, and for dying sooner than your colleague who doesn't have as much stress as you do.
People living in low-income neighborhoods that are constantly stressed by inadequate resources, by challenges for which they do not have responses, are living in these red boxes day in, day out, and it shortens their lives.
Despite the consistent results between these studies, they all suffer from the nice trees, nice neighborhood effect, right? Where are the nicer trees? They're in areas that are whiter, wealthier, better educated. What I realized is that if trees are good for you, killing them should be bad for you. Well, okay, why is that a revelation? Well, two things. One, trees are very tiresome. They take a long time to grow. So it takes a long time to see a change in tree cover. But they can die real quick. And invasive pests, which can be really devastating, they obviously have this wonderfully random component to their spread. While the presence of trees may be correlated with education, race, and income, the loss of trees may not be. So I'm going to show you a little animation now. It's going to show the spread from 2002 to 2013. Now you're going to see there's an obvious kind of wave-like spread that you'd imagine. But watch the little satellite populations pop up hundreds of miles from the nearest case. And I looked at county-level mortality from 1990 through 2007. So you have this long running period, and then the trees start to die. And what did I find? Well, I found emerald ash borer was associated with increased both cardiovascular and lower respiratory mortality. And this effect increased both in size and significance as an infestation progressed, which you would imagine, this makes sense because it takes a while for the trees to die. So you're seeing a kind of dose-response relationship. Well, I found out a woman's risk of having one of three bad things happening, so either bypass surgery, having a heart attack, or dying from cardiovascular disease, increased by 2% for each year of EAB infestation.
If environments determine health, our current health and healthcare systems aren't working to address those environments. Because as I work in a local health department, or I work in a local clinic or a local hospital, I'm not making decisions about traffic flow. I'm not making decisions about how many trees are planted in a school. I'm not making decisions about how many liquor stores there are in a neighborhood or what the speed limits are. So in fact, I'm only looking at the outcomes. I'm not dealing with the root causes of illness. And that knowledge basically has led people over time to say, if we really want to address the health of populations and improve the health in our communities, we need a new approach.
What's the dose? How much do we need?
Simply viewing a green space has been shown to reduce blood pressure, heart rate, and to lower your cortisol levels. So in terms of simple, straightforward interventions, trees is good.
We need to make sure that we build cities and maintain cities and manage cities and design places that have nature at every doorstep.
In two identical populations, one having a 23% canopy and one having 33% canopy, we expect to find 20% reduction or less obesity, 20% less type 2 diabetes, 10% less obesity over weight, a different category, and increased physical activity. Right now, the average in Sacramento for the urbanized areas is 23% canopy at this time. And I thought that this was just stunning because Ray has been saying for years that our goal should be 35% canopy for the Sacramento region.
So this is pretty profound stuff. Again, people are dying, people are having bypass surgery, and it appears to be loss of trees is a significant risk factor. For me, what they suggest is that trees quite literally can be a matter of life and death.
We spend $2.8 trillion on consequence management. We spend very little on trying to change the conditions. That's the work of the California Endowment and most public health practitioners and the Tree Foundation. It's like public health and urban planning got divorced sometime in about 100 years ago, and then they kind of discovered each other at a party again and rekindled the relationship.
Human health and human performance related to green environment is new in the policy debate. It's been around a while, but it hasn't gotten much traction. I think now maybe we know enough to use it with some traction and sort out what federal and state roles might be in support of that application.
We want to find a better way to incorporate gray infrastructure, green infrastructure, and human health and well-being.
As a practitioner of gray infrastructure, there's plenty of money coming out of the federal government to build projects. My last project that was built was a $90 million interchange and roadway extension. There are lots of opportunities to leverage those funds to create those green infrastructure elements as you move forward. It's a lot harder to find money just to plant trees, but if you can have the conversation with your constituencies, with your electeds, and with the project supporters to find ways to leverage that money to be able to create as much green infrastructure as possible when that green infrastructure is being built.
We have to stop thinking so much about the damage control part of the system, although we have to manage it, and we have to start figuring out what can we do upstream to try to manage those upstream conditions.
If we know that community environments determine life expectancy and health outcomes, what are the components that make a community healthy?
Accessibility, walkability, tree cover and landscape, and safety. So these are the tools that the developers and practitioners are going to be using on a daily basis. And the idea behind this was to show them how it's all related to public health and educate them on. So when compromises are being made and things are being valued, engineered out of a project, that you understand the consequences of making those decisions, not just to how a project pencils out, but how it affects the long-term viability of the community.
Our recipe for doing this work is that you have to enlist the people who are living in these neighborhoods. You have to build their power and their ability to participate. You have to bring together the butcher, the baker, the candlestick maker, all of these various sectors that claim to be about improving the quality of life in a community. They have to work together.
It does come down to that resident power, and never underestimate the value of what those local ideas mean to the local citizens. It's a whole lot more than what any of the federal or state agencies can provide. We can maybe assist, but assist only in the application that you're ready for.
It's not all about trees. It's all about how people operate together. Even though people are talking about the urban forest, we really need to keep in mind that humans are the big players and that we're part of this ecosystem.
Something that I really will be taking with me from today into tomorrow and to my whole life is the fact that trees are really the start of something so huge. And especially for someone like me who comes from a lower income area who does not have a lot of trees or a lot of nice green spaces to go, it's nice to know that there's some way to help cure this type of problem that I live with. And I was recently diagnosed with an anxiety disorder living in the situation that I live in, and this helped me open doors on how, on a personal level and also on a global level, how trees can really affect and change lives.
You can help us bring lasting change to our community. Join us at sactree.com/join.